Okay, so start by telling us your name, and then I wanted to ask you some questions.
Okay. My name is Nita Kowalski, and I'm the Clinical Nursing Program Director here at Valencia. I'm also a nursing professor, and I've been a nurse for 38 years,
Ooh.
a registered nurse.
So, oh, that answered the first question. How did you land the position as a nurse?
Well, land the position.
That's
Well,
what it says.
I'm currently not working at the bedside. I worked for the first, I worked for the first couple years as a nurse at the University of Pittsburgh Medical Center in a cardiac step-down unit, and then I was a nurse manager, and then I decided I wanted to get into teaching, so I did that part-time, and I also was working on the clinical floor as a nurse. So I became full-time as a clinical faculty in 1988. So I was still doing other clinical on the side, but since we take our students to the hospitals when you're in education, I count that as being in clinical because you're up on the disease processes, the medications, any changes in the equipment. So throughout that whole period up until I came here to Valencia in 2001, and I did clinical until 2005, I was in the clinical area. So I don't know how I landed my first job, which was it was a staff nurse at the University of Pittsburgh Medical Center on a cardiac step-down unit.
Okay.
That was in 1977.
Now, how would you describe your job to others who don't necessarily know what nursing is?
To describe a job as a nurse?
Yeah.
Not what I do here, because what I do here is like to place the student to work on all the clinical so that the students who are enrolled in the Valencia program have clinical sites to go out to. One instructor takes each student to a unit, from med-surg units to peds and OB and mental health. I also hire the adjunct faculty that will take them to those clinicals. As far as what you do as a nurse, you do everything as a nurse. The nurse is the person that is there for no matter what. There are 12-hour shifts, and the next 12-hour person comes on 24 hours. We're the ones with the patient. The doctors come in, write their orders, but the nurses are there, the RNs, assessing the patient for any changes, for how they're doing based on their medications or whatever they're doing for them, and then contacting the doctor if necessary. So the nurses are really right in the trenches with the patient at the bedside, if you're doing bedside nursing.
Okay. And okay, there's a question. Do you work in a team or independent environment? We both know the answer to that. I'm just going to use the audio.
Okay. What did you say? What was that again?
Do you work in a team or independent environment?
I think most nurses work as a team when they're on the floor, because they're like, if there are 35 patients on the floor, and there might be 7 RNs, and each of the RNs have about 3 patients. It's probably changed over the years. I think the assignments have gotten smaller since when I started staff nursing back in '77, because I remember taking care of 8 patients on the floor on a regular day. And now I don't think even out on the med-surg floor they would assign that many patients to a nurse. And probably one of the reasons is because the patients have gotten sicker. The acuity level is much higher than it was 38 years ago. The patients that we're getting out on the floors now are patients who maybe back 38 years ago would have been in an ICU. But now they're putting them out on the floor. There's some of the floors have ventilators, or they may have drips. They have patients monitored on the floor. So, and usually most of the units in the hospital, you're working as a team. It depends on what area of nursing you're in. If you're a nurse practitioner, you're seeing patients one-on-one, then you would be independent. if you're a staff nurse, you're usually working with other nurses, whether you're in an ICU, med-surg unit.
Okay. How does this style, like, working in a team, influence your work? Meaning, like, working with others can be challenging, supportive, helpful, frustrating, like that. How does it influence your work? Well, how did it influence your work?
Well, I think working in a team, you find that certain people, I always have a positive attitude about everything, but you find that there are people that you work with, not necessarily the nurses, but it could be the nurse techs, the nurses' aides, or some other, the clinical secretary, and they may be negative, and sometimes that negativism becomes pervasive and it brings everybody down. So what I've always tried to do is kind of stay out of the fray and stay above that, and always be positive. And people complain about the amount of work that I have to do. I have this many patients, and that's what you signed up for. And some days are going to be more. There's going to be more stress than other days. You may have sicker patients. You may not have enough nurses on the floor or nurse aides to assist you, but that's the job you're there to do, and you don't want to let the patients know. And this is one thing that always bothered me when I was a staff nurse. I would go into a patient's room and the patients would say, I hear you're really short today. I never told patients when we were short staffed, or because patients don't want to hear that. They want to know that there are people out there caring for them. Mm-hmm. And to me, you shouldn't be telling the patients problems of the unit. Those are amongst the nurses themselves, not to be brought into the patients or the visitors' knowledge. So, but I think for the most part, I think everybody I've ever worked with was very positive, and they cared about their patients, and that's the number one thing that you need to have. And if you do care about your patients and care about your job, then you'll be happy. So sometimes the nurses that are disgruntled are the nurses that maybe didn't go into nursing for the right reasons. They may have, because they know, you can always get a job, it's a good salary, but those nurses tend to burn out more quickly than the nurses who are there for the correct reasons.
Mm-hmm.